So with this device, even if you didn't use it on every patient, and you can't use it on every patient, right? It's just an aid, it's to help you out. And also it's to be used in conjunction with the saliva, to be used with it. So if part of your day you are holding the mirror, having proper posture, giving your back, shoulders and everything a break, it's just going to make life easier for you. That's the ergonomic part, which is better than kind of like this all day long. People at computers have problems, but hygienists, guaranteed you will have something go wrong. Just a matter of time.
Sometimes I needed help just because I got to floss it between the teeth was a little bit challenging, or like tightening it. But once it's in, it's like really nice. It's like where the water collects. So
You thought there was a benefit to it.
yeah. Once it's in, it's awesome.
Something that you think hygienists should be using in general to make their life easier?
Yeah.
You would agree with that?
I think I do a better job cleaning because I can use the mirror too instead of like retracting and doing everything with the saliva ejector and stuff. So.
Okay, so that's all good.
Some people like it to be flat, some people don't mind if it's vertical as long as it's suctioning the liquid. So it's part of the...
Yeah, I think it's just like you just need more practice compared to like the pure vac. It might be a little...
So I really like it. I'm used to use another device, and I could see like how it could make my life easier. How like I could use leave the device on one side and then have my hands free to use the mirror as I like without being stuck with the same device.
So this is what the Sippressor looks like right now. And this is normally placed between the 5 or 6, depending on how big the mouth is. And then if you want to look in the mirror, just gonna put it here. You want to place it right here, just in between the paws, super simple. Like this. And then you can control it generally. Sometimes you just kind of leave it like this, but that. And it's just, so right here, just place here where all the water is. You turn left a little so the water pools on this side. And then just open and close and open and close. Like fully open and close. Like close your lips. Open. That's when the suction goes through. And then close. Open. So that's how you normally use it. And then you can kind of have that indirect vision like this.
Okay, so I really like how it's first and foremost really comfortable for the client, and secondly, it's a very ergonomic device for the hygienist to use. They're able to use the mirror for direct and indirect vision, which is really helpful for ergonomics for the operator.
Okay. Girls. Basically, yeah, it's not too big either. Exactly. It's really easy to use. So you just basically floss this as if you're eating that, and it should stay.
Okay.
It's on the left side.
I was imagining like a Mr. Thirsty contrast, but this looks so much more manageable.
And you can put
Mr.
on.
Thursday told them in
I
the
don't like
first
that.
minute, take it out.
I don't like that one.
So right over here, so either like on this.
much suction I want, like I mentioned
Okay.
earlier, by pressing this up and down. So release that, release
Okay.
that. I'll release this way. And connect it with some of this up. Higher and lower. You get like really good control over.
Overall, I quite like it. I like how it's really small and it kind of hooks in between the teeth, so it's out of the way. I can imagine that's easier for the operator, but also on the patient end, I can't even feel it in my mouth, so it's not interfering with anything. I like that I can control the suction. I think the only thing is, depending on the position you're using the Cavitron in, there was a bit more spray, particularly in the beginning. You kind of saw a lot of water coming out the front, but when it kind of depends on which area of the mouth it's in. So I think it might just take a bit more playing around to make sure the spray's not coming out. But otherwise, there was no water pooling in the back.
Like ever since I started working here, and like I've used other high volume sections, and I really like this one because like I can still use my mirror, so you don't have to hold a suction. It just like stays in the mouth. It basically just gets flossed between two teeth and stays there. And this one, I noticed that a lot of patients, I don't think I've had any patients where they complain about like sensitivity, like that the suction's too cold for their teeth. So yeah, I really like it because I can use two hands.
Is for one, you guys will see it once you try it, but there's like a control where you can control, the patient is able to control how much suction that they want to receive, I guess. And people really like that option because it's like kind of like they have control over their own care. And so far, whenever I've used it with patients, they've all said like very positive things about it. So
Of it, but this one is the best.
She's a pioneer of the device.
Yeah, but along with what Eileen said about how when your patients they have that control and how they want to suction, how much they want to suction, it gives them comfort to like what they want to do and how they want to do it. And you can kind of like move it around in different sides of the mouth so that they're more comfortable, and when you get used to telling them like, oh, move your head left or right just so you can see better, and you can't use your mirror for everywhere, you actually have more visibility as well.
So there's